Inside the stories that affect you. This is Inside KELOLAND.
Welcome to Inside KELOLAND, and thanks for having us in. Coming up over the next half hour, we're talking with the outgoing and incoming superintendents of the Harrisburg School District. We'll look back at what Jim Holbeck has accomplished and what Tim Graff has planned for the future. Then we're talking with Sanford Health and the Good Samaritan Society about the recent merger between the two organizations and what it means for care for senior citizens. Plus, in just a few weeks, there will be a new face leading the CBS Evening News. We're talking one-on-one with Norah ODonnell and the vision she has for the network. Then finally, the 4th of July is just a few days away. We honor those who fought for our independence as we look back on a century with the American Legion. Well, we begin tonight with the outgoing and incoming superintendents for the Harrisburg School District. We have Jim Holbeck right over there and Tim Graff right here. Thank you both for being on with us.
Thank you.
Yeah, thanks.
All right, Jim, so let's start with you. You've been with the district for quite some time now. How does it feel to be leaving that all behind?
No, that's kind of tough, you know, after being there for 12 years and seeing everything that Harrisburg has going there. It's going to be tough walking away. I knew it was time. There's no good reason to leave, but after having done this 39 years, I figured it was time to get out of education.
What are some of the biggest changes you've seen in all that time?
Certainly the growth of our district has been something that Harrisburg has dealt with all of those years. It's been exciting. It's been an opportunity for us to be able to add schools, add programs, foster so many more things curriculum-wise for the kids. So that's been probably one of the best things at the school level. Probably statewide, I'd have to put out a plug in the fact that I didn't know if I was ever going to see teacher pay get addressed. And I was so pleased to see that happen at the state level. Our teachers needed to see that pay increase, and that was exciting. I just know how much that meant for the future of education in South Dakota.
So that was nice to be able to be with your team as that happened.
Absolutely.
Yeah. Well, very nice. And so, Tim, you officially take over tomorrow.
Correct.
What are you most looking forward to?
First of all, I'm humbled and honored to have the opportunity, and I think it's a tremendous district to be able to walk into and to have the opportunity to follow Jim's lead. And I think he's kind of set the table, so to speak, with the growth that's taking place and how well the growth has been managed. But really the first task of my plate will just be to understand what's all involved with the Harrisburg School District, get to know the programs, get to know the people, and build the relationships first and foremost.
Yeah. Well, and you know, like he mentioned, it is growing really, really fast. Do you foresee any challenges already with that, or how do you feel about taking over such a growing district?
I think, as I said, it's a great opportunity, first of all, but of course there's challenges with that. And I think anytime you have that type of growth and especially the trajectory of the growth, there will come challenges with that, and whether it be border changes or boundary changes, I should say, and drawing boundary lines, or just be building buildings. Those are significant challenges as we will look to the future.
Yeah, it's so interesting. I mean, once you start building something, it seems like you already have to think about what you have to do ahead of that, even when that's finished.
Correct, and I think looking at about 300 plus student growth per year, that's almost a building a year when you look at an elementary size building. And so it will continue to have those kind of challenges going forward, but they're exciting challenges, and it's a lot, I think, more enjoyable and exciting to manage that than it is of a district that's dealing with declining enrollment.
Is it tough to leave it all behind and turn over the keys to the district?
You know, I know that we're leaving it behind to a perfect person for the job. Tim's going to do a great job. So I don't have any reservations that way. Certainly when you're involved in a job like this, you have so many contacts with people and so many good people. And I've been pleased and blessed with the people that have worked with me there. Tim's going to inherit a great team. There's people once in a while will say to me, "Oh, I can't believe how hard your job is." And I'd say, "No, it's the easiest job I've ever had." And that's because of the people that work there. They've made that job very easy.
Yeah, what do you hope your legacy will be there?
You know, I don't know if I personally have a legacy that I would leave there. I think it's more the fact that every kid was important to us and continues to be important to us. Probably statewide, I would tell you this. I think there's some legislators that are probably very happy to know that I've retired because I've been out there pushing pretty hard at times. But I'll never apologize for fighting for public education. It's the right thing to do. It's what made this country great. And I think that it continues to need to be done to keep our schools the best place for our kids of South Dakota.
Yeah, and very quickly, one last question for you. Are you just excited to leave your own imprint on there?
Well, I think it's you want to go in and just do what's right for kids, first of all, and you let the chips fall where they may after that. But I think if we do what's right for kids and teachers, and there's nothing more important than having quality teachers in the classroom and making sure that we're supporting them in every way, including financially, is probably one of the key things that we need to do.
Well, we're out of time. Since you two know each other, I was going to ask you if you had any fun stories about each other, but we have to go to break now, so.
Perfect timing.
We'd need a lot longer time frame for me to tell those stories.
Okay, well, thank you both very much. We
Thank you.
appreciate it.
Thank you.
All right, still to come on Inside KELOLAND, a merger that has been in the works for years is now official. We show you how Sanford Health and the Good Samaritan Society's merger affects care for your elderly family members. Up next. Welcome back to Inside KELOLAND. Earlier this year, two of the biggest employers in Sioux Falls, Sanford Health and the Good Samaritan Society, officially merged. Well, with this merger, Sanford Health now employs 50,000 people. Leaders for both organizations say they hope this new connection will help them offer more services and resources to older generations, as well as people caring for elderly family members. Joining us now are Randy Bury, the president of the Good Samaritan Society, and Wade Peterson, the executive director of Prospera, which is owned by Sanford Health. Thanks for being on with us today.
Thank you.
Yeah, so explain what happened with this merger.
Yeah, it was a total combination of the coming together of the two organizations. You know, it was about 18 months ago that Dave Horsdowski, the CEO over at Good Samaritan, gave Kelby a call and said, hey, we think there's some opportunities in coming together, and you know, Sanford's always been open to a dialogue on partnerships. And so that process culminated on January 1st with the official business transaction closure. And so as of January 1, we've been one organization, and which brought us to about 50,000 employees. And so it's a big company. And I've had the honor of moving over then. I've been a Sanford employee my entire career. Started at Sioux Valley Hospital and was on the kind of the acute care side of the business for 30 plus years, but now have another wonderful opportunity to go to Good Samaritan and kind of help with the integration.
Very nice. And then is it exciting that we're at this next phase now where we're kind of seeing some of these things that happened a few months ago come into play?
Yeah, it is exciting. There's a lot of changes in healthcare. There's challenges in staffing. Reimbursement is difficult. State legislatures are strapped at trying to find funding for long-term care in the Medicaid populations, and this merger is going to allow us to work together on a lot of important things. Education for our nurses, making sure that they are finely tuned, that they know how to take care of our patients, and that we can provide quality care. So the Sanford expertise, the Good Sam expertise coming together is really exciting.
Well, and staff at both places, I understand, met last week. So what did everyone accomplish with that?
Well, this week is the annual operating conference for the Good Samaritan Society. And so, the way I would describe it is like a big family reunion.
Yeah.
And the family now just got a lot bigger. And so it's here in town with administrators and leaders from over 24 states that the society is in, representing the over 200 facilities that the society operates. And I think that's kind of a secret that most of the folks in this region probably don't really understand, is the size and scope of the society. That, just this morning we had an awards ceremony and awards handed out to Good Samaritan facilities in West Virginia. We've got facilities through Texas and Florida and the Northwest and Hawaii. So it truly is a national company with a very, very wide spread.
Right. And you talked about wanting to improve care for senior citizens. Yeah. So how do you both do that then?
Well, I think the improved care, and I think really you've hit the secret sauce of this combination. Because really in terms of size and scale, this is really the only combination like this of the two largest nonprofits, or very large nonprofits, one on the post-acute long-term care side, one on the acute side. And you know, today it's one of those things where people are moving, patients and residents are moving between clinic visits, hospital stays, long-term care, post-acute care, but it can be disconnected and not a coordinated movement as you move through those different service lines. So with the combination of Good Samaritan and Sanford, we think that now by having people on all points of that lifespan continuum and expertise in the whole lifespan continuum, that we will figure out and do it better than anybody else. But that will be the secret sauce.
Yeah, we have a couple minutes. What are some of the biggest issues that elderly patients do face right now? And you can both jump in.
Well, clearly, you know, what we focus on is we want to keep the price and the cost as low as we possibly can while maintaining quality. Now, in terms of on the cost side and the revenue and the business side of it, I'll probably let Wade speak to that, because there's a huge challenge in the long-term care industry.
Yeah, the long-term care industry has seen a lot of changes in the past few years. We just underwent the largest change in regulations that we've seen since 1987, and implementing those in North Dakota alone costs $20 million. So that's, people want to know where costs have, we know why nursing homes are expensive. Costs like that of implementing new regulations is part of it, but staffing is another challenge. Finding good caring staff that care about your residents. There's just not people out there looking for jobs. In North Dakota, our governor just reported there was 30,000 open positions, jobs in North Dakota. 2,500 of those were in healthcare.
Okay.
So finding good caring quality people to watch and take care of our staff is one of the bigger challenges we have.
Oh, we look forward to seeing how everyone makes this work and comes together. So thanks for being on to discuss this with us.
Well, thank you very much.
Thanks. Well, coming up after the break, big changes are coming for the CBS Evening News. We're talking with the network's new anchor, Norah ODonnell, when Inside KELOLAND returns. Welcome back. Starting next month, you'll be seeing a new face on the CBS Evening News anchor desk. Norah ODonnell will be taking over for Jeff Glor. KELOLAND's Don Jorgensen spoke with Norah as she prepares to take on this new role.
Norah, thanks for taking the time. Really appreciate it. Congratulations on your promotion, by the way.
Oh, thank you, Don. I really appreciate it. Thank you.
So how does it feel to be taking over the anchor desk, you know, once anchored by the legendary Walter Cronkite?
Yeah, it's humbling, and I'm honored to be anchoring the CBS Evening News. I think this broadcast is so revered because, in part, Walter Cronkite anchored it for 2 decades and was known as the most trusted voice in America. And so the admiration for this broadcast still continues because, you know, I do think that we have the most experienced journalists around, and we are committed to unbiased, fact-based reporting. Most importantly, and you know, in this diverse media landscape, we need to make sure that there is a place where people feel they can trust, and that continues to this day.
We know that you have 3 kids, your mother of 3. What do you see as some of the biggest issues facing America right now?
I do. I have 12-year-old twins, Henry and Grace, and an 11-year-old, Riley. And so as a mom, there are lots of issues that are of importance to me. Currently, the one that's the biggest issue in our house is screen time, which I feel like a lot of people are grappling with that with their kids, you know, whether they're spending too much time on their phones or their iPads and how to limit that amount of time. But also as a mom, some of the most important issues I think we are facing are not only education, immigration, and health care. Walter Cronkite once said we have a healthcare system that's neither healthy, caring, or a system. I mean, I just recently had an emergency appendectomy, and I can't make heads or tails of the bill that I got. And I think that I have pretty good insurance, and it's still quite costly. And so, you know, there are 120 million Americans out there who have a chronic illness or a chronic disease, and so they're getting bills, you know, every couple of weeks. So I have great empathy for people who are struggling with the healthcare system, getting the care that they deserve, and then having to pay more than possibly they can afford. So we'll continue to cover those stories and certainly the policy proposals these presidential candidates are putting forward.
What are some things that our viewers probably don't know about you? What do you like to do in your spare time?
Well, let me see. I mentioned I'm a mom. I'm also from a military family. My dad was drafted during the Vietnam War, and served for 30 years. So I've lived all over the world, in Seoul, South Korea, and Germany. I grew up in San Antonio, Texas. My sister now serves in the Army, so I admire the men and women who serve this country, and so we're going to continue to do many stories on that. What do I do in my free time other than making sure my kids are bathed and fed and well cared for and get dentist appointments? That's on my list of things to do that I haven't done yet. It's coming up in a month. I do like to play golf, and I do like to go running in my spare time.
Oh, that's fantastic. I'm a retired major from the South Dakota Air National Guard, so appreciate your dad's service.
Oh, great. Well, thank you for your service, Don.
Oh, you're welcome. Thank you. So as the road to 2020 begins, talk about covering this presidential election and how the CBS Evening News is going to be covering it.
We at CBS News are going to cover the 2020 presidential election like no other election we have covered before, with an incredibly talented team of journalists who are already deployed in all of the big primary states. I've covered 6 presidential elections myself and covered, traveled this great country, and I think this is an election like no other. There's a reason there's 24 Democrats who are running, the most diverse candidate field ever, including 6 women. So we've got to help break down a lot of, what are their campaign speeches and policy proposals and what they mean to the audience, and fact check what they're promising the American people. So it's a high standard to meet, and it's one that we plan to meet at the CBS Evening News, because ultimately, as Walter Cronkite said, journalism is what we need to make democracy work. We do. We need information. We need fact-based information, because that's what drives us to vote one way or another at the polls.
Last question, Norah. I know you've talked about taking your show on the road. Have you ever been to KELOLAND, Mount Rushmore State, South Dakota?
No, and I was just thinking that, I have been to so many places in America, and I have not been to South Dakota. So I am today adding it to our list as a place we are going to broadcast from in the future. I have not checked with the president of CBS News, but I'm going to make a personal promise that we will come out there and broadcast from South Dakota.
There's so many things here to see. Mount Rushmore, we had Sturgis Motorcycle Rally, pheasant hunting. That's what we're known for. So
Yes.
hope to see
Maybe
you here.
next summer.
All right. Thanks so much,
Take
Norah.
care.
Oh my gosh, we look forward to that visit. Coming up in our final segment of Inside KELOLAND.
Just a camaraderie between veterans, so I think we're going to stick around for a long time.
You find them in every city and small town. We look back at 100 years of the American Legion and how it's helping veterans across the country deal with the horrors of war after the break. Welcome back to our final segment of Inside KELOLAND. 4th of July is just a few days away. The Lyon Fairgrounds in Sioux Falls will have all kinds of Independence Day fun for the whole family. Gates open at 5 p.m. with inflatables, food, music, donut decorating, I'm there, and more. The fireworks display will start at 10 p.m. Then after the fireworks, there's another fiery show to check out. The Last Ember will perform with its fire artists. The 4th of July celebration at the Lyon Fairgrounds brings in between 6,000 to 9,000 people each year. The 4th of July is also a day to thank servicemen and women across the country for fighting for our independence. One organization that has been doing that for 100 years is the American Legion. In 1919, as American troops were returning home from World War I, veterans started to organize nationwide, eventually forming what would become known as the American Legion. Over the past century, the Legion grew in membership and programs that serve both veterans and the community at large. Perry Groten spoke to a couple of members with the Sioux Falls American Legion Post 15 about how their membership spans generations.
Harold Hansen says his proudest achievement while serving during the Korean War was simply coming home alive.
That I survived. I remember the first one I sent home that didn't, see? I remember that yet.
The Korean conflict was often called the Forgotten War, but to Hansen, who enlisted in the Army, serving your country is about duty, not recognition. It's an attitude of selflessness that ran in his family.
I got a brother that was in the Navy, a brother in the Air Force, and a brother in the Army, and me.
Hanson's father fought in World War I and later became among the first veterans to join the then new American Legion.
I just know that my dad talked about it when they formed it, and he was very proud of it.
So Hanson followed in his dad's footsteps and joined the American Legion back in 1956, a Hanson family tradition that spans nearly all 100 years of the Legion.
Well, it's the largest veterans organization in the country, and they're based on a lot of sound principles.
Douglas Tingey served in the Navy during the Vietnam War.
A lot of bad times over there. Sometimes it was even worse than normal. And when you talk to other veterans down here, you get that sense of pride between each other.
Tingey's dad was also a member of the American Legion, so Tingey joined the Legion shortly after his discharge back in 1981. Members here share a special bond they don't otherwise find in the civilian world.
You talk to non-veterans and they just don't understand what you're going through or what you've been through or anything like that. So
that camaraderie extends among veterans, young and old, from all branches of the service.
I have enjoyed talking to some of the Gulf War returnees. You know, that's a different environment than what I was in.
Yet the graying of veterans organizations like the American Legion is a concern to current members. They'd like to see more people join who served in Iraq and Afghanistan.
They just don't want to join yet because they got families. They want to get through their, I think when they hit about 50 or 60, then they'll start coming down to the Legion.
Declining memberships have forced some veterans organizations to close across the country. But members of Post 15 are optimistic. They say South Dakota has a long and proud history of military service. And as the American Legion begins its second century, they're confident new recruits will come along in the years ahead and keep the Legion marching along.
Just a camaraderie between veterans, so I think we're going to stick around for a long time.
With Eye on KELOLAND, I'm Perry Groten.
Harold Hanson is a member of the American Legion Chorus that'll perform next month during a centennial ceremony in Garrettson. You can take a step back in time to the early days of the Legion by going to this story at KELOLAND.com. Well, that's all the time we have for this week's Inside KELOLAND. You can find out more about today's topics online and at KELOLAND.com. Just join us every Sunday following the 10 o'clock news right here on KELO TV. Have a good night, everyone.